health, financial, and home improvement. Enjoy being educated in such topics as personal injury law, community association law, family law, bankruptcy law, along with health show topics like pain management, men's health, and dental implants. Now, sit back and enjoy today's Ask the Experts with host Steve-O.
Hey, it is a beautiful day in the neighborhood. Welcome. This is the Ask the Experts radio show. I'm host Steve-O, and I'm looking over at my producer because I'm hearing an echo. Okay, so this is...
So do I.
Yeah, and so does our great guest, too. So we're on every Monday and Thursday from 6 to 7. You can drive home with us. This is a live show. We're not like the other talk shows out there that pre-record. This is a live show, and I can't tell you how many emails we got from people who said, you know what, I've got pain. Do I go to a pain management doctor? Do I go to a chiropractor? How come you don't have a chiropractor? And we were so lucky to find one of South Florida's finest chiropractors. Been in business for over 30 years. Easy to get to. And I want to welcome to the Ask the Expert show, Dr. Howard Dinner. That's his last name, Dinner.
Easy to remember, huh?
Yeah. So happy Hanukkah.
How could you forget? Thank you.
Yeah,
Last
happy
night,
Hanukkah. And
I'm wearing my blue
you
shirt.
are. You look good tonight.
Thank
so,
you. It's my Hanukkah blue.
And we've also kind of become buddies because I'll go over there on a Saturday and we'll just sit and talk. And it's like, speaking of blue, it's blue versus red. And I'm not blue. He's blue. So
you'll be purple soon.
Okay. But he's such a wonderful chiropractor. And you know what? He's seen it all. So I'm so glad that we have him. The name of his practice is called Community Health and Wellness Center. And we have been always talking about auto accidents. I think you have auto accidents coming out the yin yang. So tonight, there's so many more things that a chiropractor does that people do not realize. And we're going to talk about the other things that chiropractor do. But because, Howard, we are getting so many new listeners and viewers that let's kind of remind everybody about your practice and who you are.
Right. I've been a chiropractor for almost 40 years now.
And he's only 14.
And right. And we've treated people for a whole variety of conditions. Most of our practice is, of course, neuromusculoskeletal conditions, which are headaches, neck pain, arm pain, lower back pain, sciatica, herniated discs, knee pain, shoulder pain, ankle strains. We've seen the whole gamut of neuromuscular skeletal conditions. Also, we get patients who have long-standing medical illnesses that just don't respond to traditional medicine, or people want to try something before surgery to see if that can be, their condition can be affected.
Something non-invasive.
Something non-invasive, right? What we offer patients is an alternative to traditional medical treatment, but in many cases, what we offer them is the solution to their health problem. Many people suffer with neurological impingements, which is the mainstay of what a chiropractor treats. They can occur in many different areas in the body. The most predominant area that a impingement would occur is in the spinal column, as the nerves exit through the spine. The spine is a movable organ which allows you to bend, move around, and gives you flexibility. However, it's very vulnerable to injuries, to aging, to disc conditions developing, arthritis, jolts, which can affect the alignment of the spine, which can in fact cause nerve impingements because the nerves that emanate from the spinal cord straight down in your back, of course, go to 90% of the tissues in your body and coordinate and control their function. And if you have an impingement, most people get pain, but you can have dysfunction, which could result in muscle weakness, could result in tingling, could result in numbness, clumsiness in coordination, radiculopathies, neuropathies. They all have a component or can have a component with neurological impingement, which occurs 90% of the time in the spine, but can occur in your shoulder, can occur in your hips, can occur between muscles that are in your pelvis, which can in fact cause a sciatica if it doesn't emanate from the spine. There are, as I said, multiple causes. And what we affect is the alignment. We can affect patients who say, well, I have arthritis and I need to learn to live with it, I've been told, and I'm taking medication, which helps it. And
That's not
but
true,
it just
is it?
doesn't, yeah, it just doesn't always go, it doesn't go away or is not acceptably controlled. And by our approach to looking for neurological impingements, joint subluxations, where a subluxation is not a dislocation, that's why it's called a subluxation, but it can be a misalignment of the spine, which causes pressure on the joints, which can cause swelling in the joint, which is many times not detectable by diagnostic imaging. And by affecting the alignment of the spine, we can reduce the joint swelling and we can reduce the pressure on a nerve. And we're talking about millimeters. We're
Right.
not talking about, inches. Where it's millimeters. It's
And that can make
tiny,
a difference.
and that can make a difference. It's similar to you squeeze your finger just a little bit. And if I hold this for 10 minutes, my finger is throbbing and is red and is sore and really hurts. And really, all I need to do is not this. All I need to do is just that. But you can
Wow.
hardly see. Is just take a little bit of a pressure off my finger to allow the circulation.
Dr. Denner, I have to ask you this because you've been in practice for so long. What is the biggest misnomer about chiropractor? Because there's a
Oh, it
lot of
goes
people who've never been to a chiropractor before, and
right.
they might have heard. Listen, there are bad chiropractors. There's good
Sure,
chiropractors. So maybe someone
that's
went to
right.
a bad chiropractor.
That is correct.
So
I
what?
think you told me you went to a bad chiropractor
I
once.
did. I did tell you
Yeah.
that.
See?
So
Yeah.
a lot of people don't know and aren't aware of what you can do.
Right. Well, like everything else, there's good and bad, of course. And most people in my practice, I would say more than 98% of them have had a good experience. We're gentle. We know what we're doing. Um, we're careful. We thoroughly evaluate patients for the appropriateness of a procedure that we may perform. Um, it's not one procedure for all. We use perhaps 12 major procedures in chiropractic for a patient. 12 major branded techniques taught in chiropractic colleges and integrate them in our practice. It's knowing what you're doing, and it's applying it in a careful manner. Not everybody can tolerate everything, and not everybody can have the same procedures when they're 65 years old
Right.
as when they were 35. And we get many patients who are looking for that procedure they had when they saw a chiropractor when they were 35 years old, and that may not be possible.
Healing takes
So we have-
longer when you're older.
Everything takes longer.
Okay.
Healing takes longer. That's the main component of why it takes longer, because you heal slower.
Right.
You know that. You know that when you cut yourself.
Right.
You know that from almost every condition that you may be afflicted with or get afflicted with. It takes longer for it to go away than when you're younger, because you don't heal as fast. Your cells don't turn over as quickly. But that being said, to answer your question, people are afraid of chiropractor. They're probably, number one, they're afraid of the unknown.
Right.
People are always afraid of the unknown. They've heard a bad story from somebody, and they use that to make their decision. We all do that.
Right. Yes.
Right? Okay. And somebody will tell you about a restaurant, and you'll ask them, and they'll say, I'll never go there. And you don't know from your own experience. I mean, I know from my own experience, people recommending restaurants to me, it's not necessarily,
I know.
it doesn't meet up to what your expectation. You have to try for yourself, is what I always found through my life experience. Find out for yourself. And chiropractic is safe.
You know what
It's
I
the
like
most
about
safe-
what you do?
It's the most safe procedure in all of medicine. Not to say there's
But you can
absolutely
save
no risk.
somebody. You can actually keep somebody from having surgery.
Correct.
And that's amazing right there. I mean, I would
Right.
think go to the chiropractor first and see if they can heal me first. And even you've told me yourself, if you have to send someone to an orthopedic surgeon, you will do that. But
That's
at
correct.
least give it a chance. Sometimes doctors want to operate first. And you're
That's
more
true.
holistic.
Right. We always recommend try the simplest procedures, the safest procedures, the less invasive procedures first. The surgeon is always waiting. He'll always be there. And in some situations, they'll give you their blessing to come and try something that's not invasive first to see if that helps you.
Do you see any doctors that send their patients to chiropractors?
Yes, we do.
So that's,
There are many progressive medical physicians who do refer their patients to chiropractors. And it's not like the dark ages when I started chiropractic.
and you went to the best school in the country, by the
correct.
way.
That is true. According to me, of course. I have to put that disclaimer in.
No, it is
And,
actually considered the best school for chiropractor in the United States. It's got an incredible reputation.
Thank you. But when I started chiropractic, there was a lot of animosity between the professions, and chiropractors were singled out. Medical facilities didn't cooperate with chiropractors to obtain medical records and other
Oh, yeah.
things. But that has That is not an issue any longer. You know, we refer patients to hospitals, and we get medical records easily from hospitals and other physicians without issue. And
Well, they know
you know,
you get good. Listen, maybe or back then they didn't know the kind of results that a car, but now they know that
right,
you deliver.
right.
Not any babies or anything, but you deliver. Listen, we got to go to break. Listen, give Dr. Howard, maybe mom or dad are having aches and pains. Friend of yours has been in an auto accident. Give Dr. Howard Dinner, what a great name, a call. 954-370, easy, pain. Pain. Should be painless, but to be too many. Dr. Howard Dinner. We're going to go to break. We come back. We're going to talk about headaches and sports injuries. And we'll be right back.
Dr. Howard Dinner is the Director of Health Services at Community Health and Wellness Center, one of South Florida's most established natural healing facilities, serving South Florida with chiropractic, acupuncture, massage therapy, physical therapy, and auto and work injury rehabilitation since 1988. Dr. Howard and his staff have treated thousands of auto and work injury patients. They have extensive experience working with lawyers, and part of their process includes handling every detail of billing and insurance claims, auto accident insurance, PIP, and auto accident attorney liens accepted. Many times, you will not be billed for auto accident injury treatment until your case is settled. They also accept most insurance, including all auto insurance, all PPO plans, many HMO plans, and state and federal workers' compensation. Contact Community Health and Wellness Center today at 954-370-PAIN. That's 954-370-7246.
Hey, we are back. You know, we got that echo again. Anyway, we're back, and I don't introduce any of our experts this way, but this man I do. My friend, Dr. Howard Dinner. Dr. Dinner, everybody thinks auto accidents, chiropractic, maybe low back pain, chiropractic. I want to know something before I go any further. Is many years ago, when you had low back pain, you did what was called an adjustment. Is it the same now as you did 20 years ago?
The same procedures that were practiced 20 years ago
Wow.
are still practiced. However, they've been enhanced, and additional procedures have been added
Okay.
as technology has developed and as research has advanced. So, for instance, we would use today on disc patients, we would use a procedure called spinal disc decompression treatment therapy, which is a specifically designed table to decompress, to kind of like inflate a disc, to make take the bones further apart from each other, reduce the pressure on the nerve. It doesn't involve the traditional snap, crackle, pop, as people traditional chiropractic is labeled as the snap, crackle, pop. There are other non-force procedures that are used, which don't involve that for other parts of the body, other procedures, and for patients depending upon what their needs are. So Traditional chiropractic, which was around 100 years ago, 125 years ago, to be exact, as far as the discovery of chiropractic, um, is still practiced, but other procedures have advanced.
You do a lot of work-related injuries. What do you mostly see on work-related injuries? Is it mostly back?
It's mostly back. Injuries to the back from lifting, from improper movement. We even see one of the new things that we see is carpal tunnel syndrome,
Ah,
which is actually from operate a keyboard. Operating a keyboard for 8 hours a day can cause repetitive injury to a person's wrist, and you do that over years, and you don't have, and you're susceptible to it for one reason or
what does
another.
that feel like? What is like when a patient comes
Shooting
in?
pain,
Very much a lot of pain.
yeah, shooting pain in the wrist. Yeah, it goes up, it goes into the hands. There's weakness. There's what a surgeon would do is decompress it. What we do is treat it to decompress it with natural maneuvers, and
Good
we get good
results.
success with it. Yes, we get very good results with that.
How do you treat now? How do you treat carpal tunnel syndrome? Is it a machine, or is it a technique that you use?
There's an adjusting technique. We also use a traction procedure. I personally would use acupuncture as well,
Okay.
on depending upon, and we combine the three modalities, acupuncture, chiropractic, and physical therapy, to give a patient the quickest benefit and the most long-lasting benefit. And eventually, it leads into exercise rehabilitation to strengthen the muscles and rehabilitate the area and make it strong. Or in
You've
the
got
West.
such an incredible facility. I mean, it's actually a lot larger on the inside than it looks from the outside. But you offer physical therapy.
Yes, we offer a full line of physical therapy as well. And we see many patients, both pre and post-op op for operation, surgery. We also see patients for surgery rehabilitation from shoulders, knees, backs, necks.
What about headaches? I know you treat headaches. How do you treat? I mean, is your average headache? Are we talking about migraine headaches?
We affect headaches by decompressing, reducing nerve pressure that's in the base of the neck. By doing such, if there's a component, if a patient presents with a component, a subluxation, a misalignment, and we suspect there's nerve pressure, we would treat that. And that would give us our results. Not every headache is chemical in nature. There are physical components. There could be muscle tension, and it could also be a subluxation of vertebrae that has deviated from its normal position, compromising the nerve roots or the nerves and the joints, and pulling and tugging on tendons, ligaments, and muscles, and creating imbalance. And by balancing a person and reducing nerve pressure and reducing subluxations, we're able to provide patients with relief.
As a chiropractor, how do you reduce swelling?
By reposition, the first thing is by putting the joints in a better position,
Okay.
right? That, and then also using physical modalities, such as electrotherapy, massage therapy, deep tissue goading, muscle balancing procedures, acupuncture, which would help a patient to get the swelling down. It
You know,
doesn't need to be an anti-inflammatory.
right. I'm going to tell
And
everybody
cold
this
packs.
because, you know, boy, there's people who are walking around with pain, and there's people walking around with pain that think, you know what, I've tried everything, nothing works, I'm just going to be in pain for the rest of my life. I think it comes back to what we started the show with. There's good chiropractors, there's good orthopedic surgeons, there's bad orthopedic surgeons. I am telling you, you should not have to ever live with pain. And I'm asking you, give Dr. Howard Dinner a call. You can reach him at 954-370-PAIN. That's 7246. One of the greatest chiropractors here in South Florida. And listen, he's got a good rapport. He'll talk to you. He won't talk down to you, and he'll explain to you that the way you can understand. That's because we've talked. Dr. Howard and I have talked for hours, and that's why I love talking to him. And of course, we joke around a little bit too. But give Dr. Howard a call. Give everybody your website, Dr. Howard. Dr. Fine.
Okay,
Dr. Fine. I've got
it's
the Three
W-
Stooges on my mind.
www.drdinner.com.
Just DINNER.
drdinner.com.
Okay. And
It'll take you right to our website, and you can explore more about our office and our facility, get an understanding of what we do, what our office looks like, and we are very COVID compliant.
go in for a consultation.
Yeah, right. They can call for a consultation.
Yeah.
We won't charge them to speak to them, either by phone or
He likes
in
getting
person
called at
in
2
the
o'clock in
office.
the morning. Give him a call at 2
yeah.
a.m. Anyhow, Dr. Dinner, have a very happy and healthy new year. And
Thank you.
you'll be back with us next month with more Ask the Experts. Thanks, Dr. Dinner.
Okay, thank you.
We're going to go to break, and when we come back, we'll be with our home health care.